Hip bone is a large irregular bone. It is made up of three parts: the ilium, the ischium and the pubis. The three parts are joined together to form a cup-shaped hollow acetabulum. The pubis and the ischium are separated by large oval opening called the obturator foramen. The acetabulum articulate with the head of the femur to form the hip joint. The pubic part of the two hip bone meet anteriorly to form the pubic symphysis. The bony pelvis is formed by the two hip bones along with the sacrum and the coccyx. This is the ilium, this is the ischium, and this is the pubis. These three parts join together to form the acetabulum, which articulate with the head of the femur to form the hip joint. The ischium and the pubis are separated by the obturator foramen. Side determination: the acetabulum is directed laterally. Ilium, an upper end, is called the iliac crest. Three borders: anterior, posterior and medial. Three surfaces: gluteal surface, iliac surface or iliac fossa, and a sacropelvic surface. Pubis, a body anteriorly, a superior ramus superiorly and an inferior ramus inferiorly. Ischium, two ends, upper and lower. Three borders: anterior, posterior and lateral. Three surfaces: femoral, dorsal and pelvis. Clinical anatomy: iliac crest is used for taking bone marrow biopsy in case of anemia or leukemia. Weaver's bottom: persons sitting for a long period of time may get inflammation of the ischial tuberosity bursa. This is the femur bone, anterior and posterior view. This is the head of the femur. This is the neck of the femur. This is the lesser trochanter and this is the greater trochanter. In anterior side, you will be having intertrochanteric line, and in posterior side, you will be having intertrochanteric crest. Linea aspera is present on the posterior side. This is the medial and lateral supracondylar line. This is the adductor tubercle. This is the lateral epicondyle. This is the medial epicondyle. This is the lateral condyle. This is the medial condyle. This is the patellar surface and this is the intercondylar notch. These are the parts of the femur or hip bone. Attachments of the muscles we had already seen in this video. Side determination: the upper end consists of a rounded head, whereas the lower end is widely expanded to form the two large condyles. The head is directed medially. Patella: the patella is the largest sesamoid bone in the body, developed in the tendon of the quadriceps femoris. It is situated in front of the lower end of the femur, about 1 cm above the knee joint. Side determination: the patella is triangular in shape with its apex directed downwards. The anterior surface is rough and non-articular. This is the patella bone, the anterior surface and the posterior surface. This is the apex, this is the base. The posterior surface consists of a two facet, medial facet and lateral facet. Tibia: the tibia is the medial and the larger bone of the leg. It is homologous with the radius bone of the upper limb. Its upper end comprises of a large flat condyles. Its lower end has a prominent medial malleolus. Side determination: the upper end is much larger than that of the lower end. The medial side of the lower end projects downwards. The anterior border of the shaft is more prominent and crest-like. This is the anterior and posterior view of the tibia bone. This is the lateral condyle. This is the medial condyle. This is the intercondylar eminence. This is the tibial tuberosity. This is the medial surface. This is the anterior border. This is the lateral surface. This is the tibial tuberosity and this is the interosseous border. This is the shaft of tibia. This is the medial malleolus. This is the fibular notch of tibia occupied by fibula. This is the posterior intercondylar area. This is the soleal line. This is the nutrient foramen. This is the posterior surface. This is the groove for the tendon of tibialis posterior. Fibula: it is the lateral and smaller bone of the leg. It is very thin as compared to the tibia. It is homologous with the ulnar bone of the upper limb. Fibula comprises of an upper and lower end with the lower prominent lateral malleolus and thin shaft. Side determination: The upper end or head is slightly expanded in all directions. The medial side of the lower end bears a triangular articular facet anteriorly. The parts of the fibula bone: this is the apex of the head, this is the head of the fibula, this is the anterior border, this is the shaft of the fibula, this is the lateral malleolus.